Using trauma-informed care. Often, as we are trying to take care of someone, they exhibit behavior that is unpredictable and hard to manage. Sometimes this difficult behavior is tied to trauma. In this course, you will gain knowledge and tools that can help you during these difficult times. Through this course, you will learn about trauma-informed care and why it is important. You will be able to create a calmer environment by preventing triggering events. You will develop trust and safety for those in your care. So, what is trauma? Trauma is an experience of extreme stress that overwhelms a person's ability to cope. Those experiences can be very different for everyone, but can include things like violence, hate crimes, sexual abuse, accidents, long-term illness, or an unstable environment. It can be witnessing an upsetting event happening to someone else. Trauma can be a one-time event like a violent attack or natural disaster, or it can be an ongoing stress like bullying or long-term abuse. Why does it matter whether or not we use trauma-informed care? Understanding the experiences of others has direct effects on the quality of care we provide and how well we can create a healthy environment for the individual. Trauma is very common. 8% of youth between the ages of 12 and 17 report sexual assault, 17% reported physical assault, and 39% have witnessed violence. This is just a small population of a larger group of people that have experienced this type of trauma. A big part of understanding trauma-informed care is understanding behavior and the function of certain behaviors. The function of the behavior is why someone is doing what they are doing. People engage in certain behaviors for specific reasons. Just because someone swings their fists in the air doesn't mean they do it for the same reason as another person. One person may be trying to get someone's attention, and another may be trying to get away from something. There are different types of functions of behavior: to gain something, seek attention, communicate, escape something, or to create a sensory sensation. A behavior can serve more than one function. For example, someone may go outside to both escape a situation that is bothering them while also getting the rays of sun on their skin as a positive sensory stimulation. Triggers are specific stimuli or events that happen right before and sometimes cause a particular behavior. Understanding a person's triggers is crucial for understanding why a behavior occurs and how it can be managed or modified effectively. When considering the function of a behavior, triggers can be directly linked to the reason the behavior is occurring. For example, if a person's behavior is to gain attention, the trigger might be seeing that you are distracted on your phone while they are talking. The person would then feel ignored or neglected. This trigger can lead to behaviors like shouting to gain the attention of those around them. Recognizing these triggers allows caregivers to address the underlying needs and provide appropriate attention in a positive manner. This can reduce the occurrence of problematic behaviors. For someone with trauma, a trigger is any stimulus, whether a sight, sound, smell, touch, or even a particular thought or situation, that evokes a distressing memory or emotional response related to their traumatic experience. Triggers can vary greatly from person to person and can often be unexpected, causing the individual to relive the trauma or experience intense emotional reactions such as fear, anxiety, or sadness. Triggers can be very specific and closely related to the traumatic event. For instance, a person who has experienced a car accident might find the sound of screeching tires or the sight of a similar car to be a trigger. These stimuli can immediately bring back the feelings of panic and helplessness experienced during the accident, leading to a range of emotional and physical responses such as sweating, increased heart rate, a panic attack, or problematic behavior. Understanding and identifying triggers is a crucial part of trauma-informed care. By becoming more aware of a person's triggers, you can help people with trauma regain a sense of control and reduce the impact of these experiences in their daily lives. One thing that can help you with trauma-informed care as you get to know a person and learn their triggers is the ABC model. This model helps you better understand a behavior in different stages. A stands for antecedent, or something that happens before a behavior. B stands for behavior and is the actual observable action of a person. C stands for consequences. In this instance, it refers to what happens directly after a behavior and does not mean something negative or a punishment. Let's add an example to explain these better. A person with a history of experiencing verbal abuse hears the phrase "shut up" and runs away to their room. In this case, the antecedent is the phrase "shut up." The behavior is the person running away from the situation into their room, and the consequence is escaping a negative interaction or having time alone. Here's another example. An individual who has experienced a traumatic event involving someone in a uniform sees a person in scrubs approaching them. The person reacts by yelling and screaming at the person. The antecedent is seeing a person in a uniform. Their triggered trauma-induced behavior is the yelling. When you use this model, it helps you understand an individual's behaviors better, especially when we are aiding behavior support. When we want to promote target behaviors and lessen trauma-induced behaviors, identifying the antecedent and consequence of that specific behavior is essential. Overall, this can help us support an individual's goals and help with trauma-informed care once we apply the ABC model. Using trauma-informed language while caring for someone involves being mindful and respectful of their past experiences and current emotional state. This means avoiding language that could inadvertently re-traumatize or trigger distress. This can be phrases that may remind them of past trauma. It is essential to use empathetic, non-judgmental, and supportive language. For example, rather than demanding explanations or using accusatory tones, you should ask open-ended questions and offer choices to empower the individual. Phrases like, "Can you tell me more about what you're feeling?" or "What can I do to help you feel more comfortable?" demonstrate sensitivity and respect. By fostering a safe and understanding environment, caregivers can help individuals feel more secure and supported in their healing journey. It is important to understand that language that accuses the person of behaving a certain way for negative reasons does not help the person. The words we use with others should be constructive and helpful. Creating trust with someone that has experienced trauma is very important but can be challenging. There are a few ways to help manage and reduce negative reactions to triggering experiences by creating trust. First, you must be consistent and reliable. Do what you say you are going to do every time. Be predictable in your own behavior. Try to create a pattern with how you react to things and how you deal with situations that are both easy and challenging. Second, create an environment that is both physically and psychologically secure. This includes creating spaces that are welcoming and non-threatening. Be aware of things that may be physically unsafe for the person. You can also try and eliminate things that may be psychologically unsafe for the person, like loud noises or large crowds. Last, be transparent. Be clear about what is going on, what actions you are taking, and why. Telling the person about how you are attempting to increase safety can help them feel more comfortable and reduce reactive behavior. The more you know a person, understand their trauma and triggers, the better you can create safety and trust for the individual. Trauma-informed care can be challenging, especially at the beginning of taking care of someone who has had distressing or upsetting experiences. Using the ABC model, creating safety and trust, and utilizing trauma-informed language is very important in providing quality trauma-informed care. Individuals who have experienced trauma need you to be a caregiver that helps and understands. Working from a place of understanding and empathy will be the best way to care for a person with trauma.